Miss S, thank you for coming in today so we can review the results of your assessments. You were referred to assessment due to attentional functioning concerns that have not improved with management of your depression and anxiety. I have your results right here for you. Let's go over these together. When it comes to language, visuospatial abilities, um, your reasoning, planning, and response inhibitions, those are all in an acceptable range. In these areas, we have no reason for concern. The assessments determined that your mental function is operating where we would expect. However, we did see some lower scores, some areas in which you appeared to struggle, such as reading comprehension. But we believe that this is attributed to some heightened anxiety that you were experiencing during the assessment. You won't be surprised that the assessments did reveal that you scored lower in mathematics, as you've already indicated that you have a history of struggles with this subject. What this means, though, is that you there is a disorder in mathematics that you most likely have had since childhood. Um, what you're going to do with this information is that if you find yourself in an academic setting where mathematics is the focus, you're going to want to ask for some accommodations. You can ask for some extended time to complete assignments. If you're doing standardized testing, um, the use of a calculator, ask if that's permissible, and ask for extra breaks. Those are all going to help you master mathematics a little bit better. Excuse me. If let's see. On your reading assessment, you showed an improvement when you were given extra time. However, your scores are a little bit lower than we would expect from somebody with your level of education. While you showed an average range on attention in your working memory, your results did indicate when it comes to sustaining your attention, you scored on the same level as an individual who has ADHD. Um, there are lots of tricks and tips that many people with ADHD have found that's beneficial to help them manage sustaining attention. I would recommend taking frequent breaks when you're working on a hard task. Um, I would recommend there are apps out there that will remind you to take breaks and encourage you to work when you should be working without distraction. I would recommend if you have a task to do that is going to be tedious or something that's going to be harder to do, I would recommend that you would move yourself to a spot where you're off from everybody else, where you're not looking at any action. If you need to use noise canceling headphones, use noise canceling headphones. In addition, I would say to get yourself a notebook. This is the best tip that anyone ever gave me to help me with my focus. Um, while you're working on a task that is going to take a lot of time or a lot of attention, and um, things keep popping in your head, you want to hop up and get those done. Instead, write those things into your notebook, and it's going to get it out of your mind and onto paper so that you will be able to focus on the task at hand, knowing that when you're done, you'll be able to go back to those things that you were worried about forgetting. Um, Another thing that people with ADHD struggle with is keeping track of their items. If this is an issue with you, assign a spot for each item and make sure that you're putting it back where it goes whenever you're done with it. I like to call it their home, and it makes me feel like I have to put them back in their home. Otherwise, they're going to not be found, and I'm going to waste time looking for them. When it comes to your mood, it would appear that you are experiencing high levels of psychological distress. This is increasing strain on your relationships, your depression symptoms, your anxiety symptoms. Because of this, you may feel as if you're experiencing isolation from others. Your results also indicate that your anxiety is in the severe range. Your depression symptoms, however, are still pretty mild comparatively. For you, it is advisable that you would seek therapy. And I would caution you to put the effort into therapy. Know that it's going to take time and don't quit it too quickly. If you quit too quickly, you may not reach the full benefits of treatment. Um, do you have any questions about any of this? Or is there something I missed on here that you have questions about? Let's go over it.